There is no surgical procedure that does not involve some risk. Osteotomy is no different. At Hampshire hospitals, the level of risk associated with this procedure is low.
All the general risks that go with surgery also apply to osteotomy surgery. The main risk we're concerned about, again, are infection. It's rare, much less than 1%, but if you do get an infection, that may require further surgery, even removal of the fixation device, and is fairly debilitating. It is very rare.
Slightly higher risk of bleeding for the same reason. We're cutting the bone. The bone is full of marrow. It bleeds and it bruises, and so it can be bruised and swollen for a little while.
Blood clots within the leg, again, are rare, but more common than after arthroscopic surgery. We here at the Hampshire hospitals do everything to prevent blood clots by using mechanical foot pump devices and getting you up as quickly as we can after surgery. If you're deemed high risk, most of these patients won't be, but if you are deemed high risk and you've had blood clots before or whatever, we may put you on something to thin the blood and further decrease the chance of blood clots afterwards.
The two main risks with the osteotomy are that we cannot guarantee the bone is going to heal. Again, that risk is very low. In our series, about 2% of the patients have not healed. 98% have gone through without any problems at all. But 2% have required other surgery to help the bone to heal afterwards. Sometimes the metal work is uncomfortable in those patients and needs to be taken out. Or if they're going to need subsequent surgery, if they might need a knee replacement later, often we have to take the metal work out, and we'll often try and do that at least 6 months before our knee replacement is done.
There is a small risk of not achieving the correction you planned or not achieving as much pain relief as you planned. This is slightly variable, and some patients confound you, but most patients don't have any of these problems after surgery.
If you'd like more detailed information about the potential risks associated with osteotomy surgery, take a look at the osteotomy booklet, which you can find in the resources section of the website.